So I want to say, and I have to say that non-pharmacological interventions have been mentioned by health authorities WHO in 2003, WHO Europe in 2021, European Centre for Disease Prevention and Control in 2022, European Commission in 2022, and many scientific and health societies. Given their potential to improve health and quality in life on the long term, reduce healthcare expenditure, and trigger behavioral change. They improve prevention and health care and complete biomedical treatments with the progress of early diagnosis and systemic impacts of chronic diseases. However, fake health news have spread rapidly in the past, in particular during the COVID-19 pandemic. It's therefore urgent, very urgent, to provide a European tool for the citizens, patients, professionals, and healthcare operators to be identified evidence-based, manualized, targeted, and personalized NPIs. This will allow better choice, engagement, traceability, and possible financial coverage along the whole health value chain. Such a scientific validated framework for NPIs has just been co-designed here in France in a transdisciplinary, intersectoral, participative and independent scientific study supported by INSERM, co-constructed with over 1,000 patients. This work resulted not only in the definition of a perimeter of psychosocial, nutritional, and physical practices to define prevention or care protocol, registered and supervised by a qualified professional, but also, and most importantly, it produced a centralized European register of labeled, described, and codified practices that has just been launched here now in Paris in October. The aim of this first European multi-stakeholders forum on NPIs is to present the study and the science that led to the construction of the NPIs registry in France, and to explore the interests and feasibility of uptake and deployment at European level. It will hopefully initiate a roadmap covering the whole value chain from research to practice, in particular economical, regulatory, training, digital interoperability, best practices, monitoring, and dissemination aspects. The purpose of this roundtable is to share our ideas and experiences for building together the European and worldwide value chain for NPIs. And for this discussion, we have the pleasure to have brought together Professor Grégory Nino, our founder, president of NPIs, Sabine Gourjon, Director of Gerontological Project Hospitals and Health Services, Clariane, Professor Iveta Nagyova, President of the European Public Health Association, EUFA, and Professor Linda Powell, Chair of Preventive Medicine at Rush University Medical Center at Chicago. To begin with, I'd like to say a few words about the network of European and world contacts that we have already established with the NPI's International Development Delegation. We already have more than 80 contacts around the world in different countries on the 5 continents: Europe, Africa in the north, in the south, America, north, south and middle, Asia, Oceania with Australia and also New Zealand. These contacts support the NPI model concept and are ready to contribute in this dynamic of broadly multidisciplinary and synergistic thinking about non-pharmacological interventions. This vast worldwide network includes scientists, researchers, and clinicians, as well as healthcare professionals in the field, including specialists and general practitioners, pharmacists, nurses, physiotherapists, psychologists, speech therapists, occupational therapists, as well as recognized practitioners in several specializations of non-pharmacological interventions. And of course, also many patients and carer associations who want to participate together in this new way of approaching health and the means we have to preserve and improve it. Now to begin our round table, I let Gregory Nuno, our founder president, set the scene with, among other, a response from the European Commission, maybe? It's your turn.
Let me share a letter we sent 5 years ago to the responsible of Europe. This is Dr. Bucher, the chief of the Europe DG Health. We want to mention for health, we have to improve the research on NPIs. And this is her answer. First of all, NPIs are complementary and alternative medicine. NPIs are traditional medicine. Absolutely no, definitely no. It's a real mistake. Second argument, they focused, Europe is only dedicated to drugs and medical device. So please pass your way. Europe, it's not a question of health. For health vision, NPIs are not solution for health. It's just for fun. Crazy. But it's not the end. The end is that, oh, you know, probably NPIs are services. And services is only for the state. Only for the state and not for Europe. Are you kidding? Services are very, very important for health. If you are here, thank you to be here at 7 o'clock, 5 o'clock. But we have to change the way of thinking about Europe. And Iveta, chief of UFA, you have to think that. And we have one major opportunity. It was terrific, terrible, but it was COVID-19. The COVID pushed Europe to write 3 reports, very important, about, they discover that we need drugs, we need product, we need surgery, but we need also services. Crazy. But we can have a momentum right now to push the regulators, the politicians, to think about the health services. That's why we create these events, and we can share the opinion of all the persons here about services and how humans can improve, prevent the health for another human and not only robots. Here we go. Thank you to be here.
So we can begin to discuss, and the first question would be what needs and expectation might be met by a consensual research framework in Europe, and maybe also what about in USA? Who want to speak about this? Maybe Iveta, the first, maybe? And Linda after? Yes?
Okay, it works. So, thank you very much for sharing this letter, Gregory. I think it's really shocking. Yeah. It's shocking, and the time is really right to talk about the need for consensual research framework across Europe, and maybe we will hear also what can happen in the US later. But why it is very important? It is because today we face the great pressure on healthcare systems, like I showed you in the morning, and therefore the role of NPIs in improving people's health and well-being and reducing the healthcare costs has never been more crucial. So we have to act very quickly. And NPIS, as we heard, whether psychosocial, nutritional, physical, represent a powerful tool for both prevention, but also for care. And the World Health Organization and the European Commission and also other societies in Europe already highlighted their potential to improve the health outcomes and trigger behavioral changes that can benefit individuals and communities. However, the surge of misinformation, especially since COVID-19, has created an urgent need for citizens, healthcare professionals, and policymakers to access accurate and evidence-based information on non-pharmacological interventions. Fake news spreads rapidly online, confusing patients and undermining the trust in non-pharmacological approaches. Like we've heard, that people still believe that it's traditional medicine or complementary medicine or alternative medicine, all kinds of nonsense. And we know that non-pharmacological interventions are evidence-based and are proven to work. So this is where the establishment of the European research framework for NPIs becomes not just beneficial, but basically essential. What NPI Society in France achieved is groundbreaking. A scientifically validated framework that aims to standardize, codify, and label NPIs based on rigorous evidence. It offers citizens and healthcare operators with the tools to make informed, traceable and credible choices, improving the uptake of NPIs across the health value chain. But this work cannot and should not remain confined to France only. The challenge now is to build on this foundation and scale it across Europe, creating a harmonized research framework that ensures NPIs are accessible, transparent and validated throughout the continent. A Europe-wide approach also can help to tackle key issues such as regulatory frameworks, economic viability, digital interoperability, the standards for implementation research, and training for healthcare professionals. And most importantly, it will enhance the trust by providing clear, evidence-based guidelines that protect patients and healthcare professionals from misinformation that we discussed. So this is from my side.
And the USA, maybe? Linda, do you have a microphone?
So if you think that Europe has problems, the United States has more. We in the United States look to Europe as people who are way advanced in NPIs relative to where we are, that you embrace it, you embrace the concept of mind, body, and there is a small group of us in the United States who are very committed to that, but there's this huge healthcare system that doesn't care about NPIs at all. They only care about developing new drugs and developing new surgeries, and the money goes into those. So I hate to be cynical, but you're the model we're trying to achieve. And my best example of this is the new obesity drugs that we have. So for many years, we tried to help people lose weight in our behavioral interventions, and then all of a sudden a drug comes by, and the drug can produce rapid weight loss. So people who are on the medical side in the United States say, we don't need to change behavior. We don't need to change lifestyle because we now have a drug. But here's the problem. As soon as you stop the drug, first of all, the drug in the United States is very expensive. And as soon as you stop the drug, you go right back to the weight that you were on before you started taking the drug. So now we have a drug that produces weight loss, but you have to be in it for the rest of your lives. So what is the solution to that? In my mind, we have to develop stronger NPIs. We have to develop non-pharmacologic interventions that are powerful, that are scalable, and that help people make changes that are that endure over time. And that's one of the reasons why I'm very committed to this idea that one of the problems that we could fix is a problem of training young people to start working with behavioral or NPI interventions at the very beginning of the development of the intervention, and cultivate and support them as they're working along the process of developing their intervention, because our future right now is in the hands of the young people. And if we can teach them what we know, and hope that they will go to a level that's higher than ours, that's how we're going to make a change in the United States. It may be different in Europe, but in the United States, our future is in the hands of the young people. Train the young people, work with them so they develop stronger behavioral interventions or non-pharmacological interventions, and let them spread their wings and fly. I think that's the future.
And besides, with the non-pharmacological intervention, we have no lack of stock as with medications, yes, because it's very close to human. And in the same order, maybe what barriers and pitfalls we might encounter as a result of economic differences specific to the various countries in Europe, maybe, and elsewhere. Maybe Iveta and Sabrina. And Sabrina first, yes?
So there is a strong potential economy using NPI, and the culture and the approach of NPI is very different from one country to another. First, because of the training, initial training of the caregiver, and we said already today that this is a basis. If we want the people to use more NPI, we need to train more since the very beginning of the training. So it means that in countries such as Netherlands or even UK, it's already NPI is already part of the initial training, and it means that NPI is very basic practice in their daily job, which is a very good thing. And this means also that the other actors involved know what NPI are and what are the benefits, and so there is a matter of communication with all the people in the country for them to make sure they understand we are talking about strong, robust and serious medicine when we are talking about NPI. There are also differences of culture, because in some countries like France or like Spain or like Italy, the weight of doctors and the technical aspect of medicine is stronger than in other countries. So it's difficult, even if we know that we can do huge economy using more NPI, such like for prevention, for early, as soon as we have early diagnosis, or even then to reduce the impact of the disease. We know we can do strong economy thanks to that. But there is again, a strong impact of the culture and the health policy that slow up the dissemination of NPI. I don't know if I answered your question, but
yeah, I can continue. And
I don't necessarily have an answer. The question is more interesting.
well, I was thinking about it as well. So, what the benefits could be the NPIs, and actually, to meet the innovative solutions for the growing burden of healthcare costs in overstretched and overburdened healthcare systems, NPIs definitely present one of the innovative solutions. And the chronic conditions currently account for 70 to 80% of the total healthcare expenditures. And the traditional approaches which rely on pharmacological treatments, while necessary, are not sufficient, and we will not have enough money in the system to give everybody enough drugs and sufficient drugs. And Linda, you mentioned the drug for obesity, but apart from the fact that people go back to be obese, there are also side effects. It messes up the immune system. There are problems with mental health. Many people do not even tolerate it. So this is definitely not the answer to the increasing prevalence of obesity worldwide. But what can happen, what we can do is that by reducing the incidence and progression of chronic diseases while we implement effective non-pharmacological interventions, it will help also to lower hospital admissions, complications, and need for costly medications. So from the economic standpoint, prevention is far less expensive than treatment. And I still don't understand why people in the European Commission don't understand it, why they are not supporting more projects dealing with prevention. And also studies have shown that investing in NPIs can deliver a significant return on investment. The European Commission and WHO has already highlighted the potential of NPI, but still, somehow it is not happening. So what is interesting about NPIs is also the support and shift toward value-based care, and which emphasizes patient outcomes, patient in the center, and also the cost effectiveness. And by integrating into standard healthcare protocols, well, by integrating NPIs into standard healthcare protocols, we can optimize relocation of the resources, ensuring that both financial and human resources are directed towards non-pharmacological interventions that deliver the highest impact. But the economic benefits go beyond healthcare system, because healthier populations are more productive populations, are resilient or reliant on social support, and lead to more resilient workforce. So if we want to achieve this, again, we need coordinated action across Europe, and a standardized evidence-based framework like the NPIs registry can help to scale these interventions content-wide. So this is my view on economic benefits of the NPIs.
Good argumentations. So thank you. But the problem is that we are in a society that promotes short-term efficacy with a miracle pill. So maybe NPIs is a revolution of ideas also.
But I think Linda's research this morning showed that very nicely, that maybe sometimes we also go for low-hanging fruits, like behavioral scientists, because we are researchers and we need to publish, and non-significant results are not published. So I was really appreciating what you are doing, Linda, that you are looking for long-term solutions, long-term effects. I think this is really the way for NPIs for the future.
With an active participation of also the patients and caregivers also.
And we can have a very short-term effect and benefits in terms of economy with NPI. The question is more how our governments are willing to go forward. If we refer to the physical activities, we know that results can be quite immediate. on depression, on after cancer, or for old people, and this would directly reduce the falls, reduce the duration of hospitalization, and in 1 year we can have very immediate scale economy, but we need we need our government to go forward on such topic. We cannot do it on our own and alone.
Yes.
So I was in an Apple store about 2 years ago, and I got into a conversation with the person who was helping me, and he said, "What do you do?" And I said, I'm in behavioral medicine. I'm trying to help people optimize their lifestyle so that they can prevent development of different kinds of chronic diseases. And he said, "Okay, tell me what the magic bullet is. What's the best thing that I can do in order to live a healthy lifestyle?" And I said, "It's physical activity." Because it's true, physical activity is related to everything. If we can just get people to move more, it has benefits. It has equal benefits to antidepressive medications. It has benefits for all of our chronic illnesses. So why is it that it's so important? Why is this strategy so important, but we have such a difficult time getting people to do it? Why do people not want to be physically active? That's a challenge for NPIs. If it's related to everything, then where are interventions that are going to help people make a change from a sedentary lifestyle to an active lifestyle? And I think that is fertile ground for NPIs to get into this issue of physical activity and figure out how we can make this more attractive to people. And I think we have sold the public an unfair set of goods, because somehow we have managed to get the public to think physical activity is about deprivation. But yet, if you engage in regular physical activity, you realize that your mood improves, your outlook on life improves. It's got all these immediate reinforcers associated with that. But why can't we get the public to do that? So I think societies like this one and what we have in the United States tackle a big problem and figure out how we can find a solution to that. Because you know what? If we don't find a solution to the physical activity dilemma, they're going to develop a drug for it. And then we're going to get thrown out of the barrel once again, because now we have a drug for physical activity. But what I'm saying is that we should figure out what our big problems are and figure out how to strengthen our NPIs so that they really have a benefit across a whole variety of different outcomes, and a benefit that's sustained over time. And I think that's our challenge.
Agree.
I mean, do we have the physical activity interventions that we can say, hey, you do this intervention and people will be physically active for their whole life? The answer is no. We don't have that. So that's a big challenge, and that's something that we should turn our attentions to, especially in mentoring our young people.
Yeah, I do agree.
I got that from you.
Yeah, and it's also a matter of prevention. I think that most of our public health policy focused on care and maybe didn't focus enough on prevention, even starting at school. And but the prevention is absolutely key, and NPI are fully part of prevention. Detect early the disease when they are, and prevention with food, with activities, physical activities, and so on.
Well, you want to say something? No, I was telling that maybe I'm going to promote your dream now, because I really like what you said, Linda, that we have to strengthen the NPIs to have them more efficient and more evidence-based. But what also has to happen, and that's what I'm saying, that is your dream, is the European regulatory framework, perhaps. Because currently the landscape of NPIs is very fragmented with significant variation between countries and interventions, how they are defined and how they are regulated and integrated into healthcare systems. So the lack of standardization poses really several challenges because it creates confusions among patients and healthcare professionals. It also limits the access to effective NPIs. And it makes it too difficult to ensure that interventions are evidence-based, safe, and delivered by qualified healthcare professionals. So the European regulatory framework for NPIs would address these issues by a clear, standardized definition of guidelines for development, validation, and implementation of the NPIs. And this framework would also ensure that NPIs subject to the same rigorous scientific scrutiny as pharmacological treatments, guaranteed that only evidence-based practices are promoted, and it would also establish professional standards for delivery of the NPIs, ensuring that practitioners are properly trained, as you said, are accredited, and that interventions are personalized and safe for each patient. So, moreover, this harmonized framework would facilitate cross-border collaboration, scalability, and also innovation for further research. So I hope that I tackled what you would like to achieve with the NPIs in Europe.
It's not a dream, it will be the reality.
Yes.
Because, you know, the promotion is, we need promotion, but when I took the same picture in the stairs and escalators 10 years ago in Paris, and the person stay in the escalator and now stay viewing the mobile phone in the escalator without using stair, and the politician in their mind, they do the job with events, with promotion on TV, etc., and that's it. But the reality, the sedentary increase, so the person know that they have to move, but it's not enough. We have to change and to propose, and that's right, something more. And the French say, oh, with the Olympic Games, everything will change, you know? And I take the same picture after the Olympic Games, and the Parisians are on the way in the escalators, viewing her mobile phone without using stair. So it's just a dream. And so with the increase and the progress, advances in precision medicine, it's a chance for all humans to understand that they can change their, so they need some starter, personalized, manualized, focused, targeted, but very efficient. And it's the first step to change lifestyle. And it's very great to explain for you the benefits for health, but also economics. But two other aspects are very important. Social, the role of human to treat, to care, to support another human. Because a vision of some start-upper or some transhumanist say, oh, the robot will care us. But it's a mistake, it's a dream, it's just some Californian Hollywood guy, but not the reality. Or maybe some people in the planet, but we need to have this social value and to think about how the value, and we are not economists, we need to increase, to invite in the NPIs or in our society and EFA economics, to think about the value, the social value or the human value. The intervention, it's not only a business, it's not only sanitary, but it's also a social or humanistic value. And how we can measure, I don't know, I'm not economist, but we have to think about the added value in the value chain. And the second aspect is about the environmental aspect. Because a lot of robots came from everywhere, but the costs are very, very important. But for example, in some countries, especially for example in France, okay, you have Paris, but you have also small town. And we can have maybe 2 hours with a lot of carbon to visit a guy. So it's also environmental impact. So we have to think about, with the experts, politicians, regulators, economists, how we can measure the value of the environmental value of NPIs. Because we have, with a clause in Kozice, or in Paris, or in Chicago, the psychologist is just near. So the cost carbon is very light.
So, and besides, NPIS is also important not only in prevention period, but also when you are sick. And we have in the Parkinson Association some people that were very high sportive people, and they realized triathlon, for instance, in the Olympic. And so we know that when you are sick, you are suffering from Parkinson's disease, for instance, the physical activity has the same value of treatments, of medication treatments. So we have shown them the example, and that's quite, besides about education, we have to spread.
And you mentioned the importance of the relation, the human relation, and you're absolutely right. This is absolutely key in the benefit of the NPI. And today it's difficult to measure the economical impact of this human relationship. And this is a pity. I have no clue about how can we measure the impact, but it's absolutely key. Someone alone with just few drugs for sure cannot improve his health in the same condition as someone with a little bit of drugs maybe, but also NPI and this relationship and the corresponding human relations.
I think we really have to adopt this way of thinking, but actually the Nordic countries are far ahead. They are promoting very much the well-being economy. So it's not only profit, but as you say, also the well-being of the society, how people feel, how they are satisfied with life. Yep. So this also counts, right?
Yeah, quality of life.
Quality of life, yes.
So I think the world has changed. You know, I think we're talking about the importance of the social influences on people's behavior. I would never have thought that we could do an effective intervention that was based on Zoom before the pandemic. I would never have thought that. I would have always argued that when people are face to face, they're much more intimate with one another and can talk more easily. But what I've seen since the pandemic is a breakdown of that barrier, and I am now watching people talk very intimately with one another over Zoom. So developing a social network with people that are all over the country, or even greater distances, is now within our grasp. And if we are trying to move toward interventions that are more scalable, like a pill is, so it's really easy to buy the pills in the pharmacy and take one every day, right? So our NPI interventions are not as easy to take. But what's happening is now we're able to mobilize the power of the social network with much less cost than we ever had before. And my goodness, I think if there's something that we should be going for is building the repertoire of interventions we have that spread the net wide, but don't sacrifice the efficacy. So I think we're in a different world now, and we need to capitalize on that.
But it's interesting, really, with COVID, because every crisis is also a chance for change. And actually this happened, and we just have to use the momentum. This will not be here forever. And I've heard last week a very interesting sentence. I've never heard it before. It's not rocket science, it's behavioral science, which is much more complicated. And it's true, because human beings are complicated beings. So there is really still a lot of work ahead of us, how to do good NPIs and how to behave our behavioral interventions.
Yeah.
Maybe with the NPI's ideology, we will introduce some humanity in economy.
Yeah.
And so to follow, because we have just an hour to discuss, so we have to go on. And we know that the regulatory frameworks are quite different between the countries. What do you think about it? It's possible or it's feasible to make homogene the system or not? It's very necessary or not? It's possible or not? In Europe and also through the world with America, Africa, Oceania and so on? Maybe Linda?
It's a very difficult question. And I think what you're saying is, could we have homogeneous standards across all of the countries in Europe where we have to achieve certain benchmarks in order to claim that our intervention is evidence-based? Is that, have I got it right? Is that what you're asking? Because we are not able to do that in the United States. In the United States, everybody competes with one another. And so the question, so I am an advocate of a treatment development model. We use the orbit model, but there are other models that exist as well. So do we want to try to get all of the people from all of these models to come together and agree on one standard model? I think in the United States that would be that would be like flying, you know, an individual flying. But what we have done is we have gotten the point across that it's really important to have a model. It doesn't make any difference which one you follow, but just have a model. So we're trying to short circuit the tendency to compete with one another. And the other thing that we have infiltrated is the funding mechanisms at the National Institute of Health. So all of our young people are trying to get funded. That's what their academic careers rise and fall on, whether they can get funding for their research. So what is happening now at the National Institute of Health is that they're all asking for an intervention development model in these grants. I review comments from study sections all the time, and I'm beginning to see that it's having an impact. We're changing the culture of the funding mechanisms rather than trying to get all of the people who are doing treatment development together and to agree on something. And as a result of changing the funding mechanisms, we're changing the young people. So the young people are all now thinking about treatment development models where they never thought about that before. So I may be cynical because I think the United States is much more of a competitive culture than what you see in Europe. And it wouldn't happen directly by harmonizing, but we go indirectly by having an impact on the funding mechanisms, and then what we're doing inadvertently is getting much more harmony. So that's how we.
That's very interesting. I think I have the lack of my knowledge of US. I thought that you are much more homogeneous than Europe, to be honest. But for me, I may be naive, but I believe that in Europe it's possible. For example, with the recent European Health Data Space, it's a great achievement. It's about interoperability of the data. It's about, how countries can harmonize to use mHealth, eHealth, these kind of things. So it's interesting. But I would be curious, Sabine, what do you think about it? You have experience working across countries. So is it, sorry for replacing you as a moderator, but I'm just really curious.
I think we don't need one unique standard. What is important is to remain evidence-based medicine and have a structure to evaluate when an API is efficient, robust, strong, with a strong scientific evidence. But we don't need one unique standard because I think it's not feasible. Because of the culture, because of the public health policy, because of the financing structure in the different countries. So, I'm not sure this is helpful to try to have one unique standard. What is important is the scientific proof and the scientific evaluation and structure for the protocol, but then to make sure we use robust NPI. But then each country, or even each region, because you know that depending on countries, they have their own rules depending on region. We can have several standards.
So it's not only a question of research framework, but also for a registry shared and can improve with the feedback of the user and the professional. That's why we need a value chain of a framework, of a global framework, not only research, but also practice. And we have to change that. That's why we would like to organize in Brussels with Iveta Nagiova an event specific to think about all the framework, all the value chain from research to practice and to practice from research. It's really a change. It's not only a question of researcher, it's also a question of all the chain.
You know, I think you're making a wonderful inroad in this, and that you're not trying to get everybody to agree, but you're spending time figuring out what high quality evidence is. And you can get more agreement across people if it's what is scientific quality. And I shift over to the drug development model, and they have specific pieces of information. We understand the mechanisms. You see, when I was looking at the NPI figures, we understand the mechanism. We have a prototype study that shows that there is some benefit. And then we have intervention studies. And in the drug world, you will not get anywhere unless you can show that the drug is effective in a phase 3 efficacy trial. And so moving into what is effective and important evidence for our treatments is exactly where you're going, Greg. And you've been going there for easily, ever since I've known you, which is probably more than 10 years, maybe 15 years. Right. You're moving toward an articulation of what quality of evidence is. And I think that is very much needed in the NPI field.
But our ultimate aim is to get NPIs into the system, just like we have pharmacological treatment to have non-pharmacological reimbursed by health insurance companies. But then we need some harmonization, because in Europe, you know, you can have care also from other countries, and then there needs to be harmonized.
Around the issue of quality of evidence.
Yeah.
Harmonizing on this.
And also reimbursement.
You know, I've heard people say, I have an evidence-based treatment, and I say, well, what's the evidence for it? And they show me a paper that was a pilot study of 20 people. And they're saying, this is evidence for the value of this treatment. And I think, gee, yeah, there is some evidence, but that's not the quality of evidence that I would look for. I would look for something that was much more rigorous in a fully powered clinical trial, or something like that. But what's happened is the concept of evidence or evidence-based is in the eye of the beholder, and what one person would say is evidence, another person would say, are you kidding me? That's really not the kind of evidence I'm looking for. And that's what I love about what you're doing, Greg, is that you're articulating what we're looking for in saying that an evidence-based treatment is truly evidence-based. You're going to the quality of the evidence, and much more power to you for doing that.
It's not you are in the box too.
Yeah.
But actually, Linda, you inspired me because there is something what we did not discuss, and it's also raising awareness about the concept. You know, like you had the answer. So many people do not understand what we are talking about, you know, even they really think that it's like alternative medicine or I don't know what. So also education is very important at the medical schools as well, not only in psychological schools, but also for the medical doctors, for healthcare professionals, for public health professionals to understand what is the value, why we need it, why it is relevant, that it is evidence-based, and so on. So,
and even in the first years of schools also, to recognize emotions for the child, it's very important too. Yeah. So I think that we have no time enough to all the questions, Gregory. Have we to sum up something, or Gregory, you can try to summarize?
Oh, maybe one more thing,
yes,
because I just forgot to say, and it's related to raising of the evidence, because I was involved in working on the behavioral and cultural insights resolutions and action frameworks. And I don't know how is it in US, but in Europe there are very big differences between the countries. So in some countries like UK or maybe France, people know what are behavioral interventions, behavioral cultural interventions. But in countries like Slovakia, the government never heard about it. So we even have to educate the governments in Europe, and we did the action framework. So we measured where the countries are. It was a self-measuring tool, and or self-report tool, and in 2 years it will be measured again where we moved so far. So this is actually what I wanted to add, that we don't have to teach and raise awareness not only among healthcare professionals, but in general populations as well at the level of the Ministry of Health and government.
Really? In French we say, on n'est jamais prophète dans son pays. You can translate? We are not the master of prophecy in our own land.
You never prophet in your own country. Ah, okay.
Yes, in good English. Thank you. So, need to summarize? Not? It's clear in this maze, yes? And so, thank you for all. Thank you for all. That's the final words. We can, of course, continue to the discussion with you afterwards if you want. And good evening. Enjoy yourself. Thank you for